Hi friends, today we will continue our conversation on the topic of cholesterol. It's video number 3. We will talk again about statins, levastatin, pravastatin, Lipitor, or Crestor. Today conversation is about loss of libido or low sexual desire. I also will say a few words on the topic of acne. Let's go. In previous presentation, I said that cholesterol in our body form out of acetyl coenzyme A through pathway called mevalonate pathway. Those arrows represent conversion of one substance into another. At the end of this pathway, dolichols, ubiquinone, and cholesterol get formed. Those arrows represent enzymes that help to run this reaction. For example, in this particular case, HMG coenzyme A reductase is participating in reaction, driving the conversion of acetyl coenzyme A into mevalonate. Statins inhibit this enzyme. As a result, concentration of mevalonate is lower. As a result, concentration of dolichols, ubiquinol, and cholesterol is become lower. In previous presentation, I said the result of low cholesterol on formation of bile and effect on digestive tract, and also vitamin D and cancer. Today, I'm going to talk about steroidal hormones. And I will talk on example of adrenal gland that located on top of the kidney. And it's used cholesterol to form 3 main hormones. One is aldosterone, the other is cortisol, and the testosterone. Out of testosterone, in males, intestine, dihydrotestosterone get formed. Out of testosterone, different estrogens get formed. So if person takes statin or cholesterol-lowering drug, we may assume that cholesterol become lower and may not be available to form all of those steroidal hormones. As a result, we will see effect. And indeed, almost 100% of the people who take Lipitor or other cholesterol-lowering medication will have low libido because low production of testosterone. Well, how about aldosterone? In order to understand the effect on statins on aldosterone, you need to know what aldosterone does. It keeps sodium in the bloodstream and potassium out. When the sodium is in, water is in, and we are able to maintain blood pressure in cardiovascular system. If aldosterone become low, here on the left corner, you can see in red and italic what will happen. The blood pressure will become lower. Now, we talked about aldosterone. So out of cholesterol, cortisol get formed. What's the purpose of cortisol? There are many purposes in our body. I choose to talk today only about 3. Number 1 is control of blood sugar. It will help to release glucose from the storage. If cortisol become insufficient, not enough because of the cholesterol become low and unavailable, then the blood sugar will remain lower. Tissue repair. In normal cortisol, cortisol is responsible for delivery of nutrients, including sugar, into the damaged tissues. As a result, repair will happen. If cortisol become lower, then injured tissues repair very slowly, and wound healing takes a much longer time. Immune system. Cortisol suppress or keeps under control immune system. So let me give you a parallel example. When person has asthma, basically inflammation airways, and in order to control that inflammation, they will take inhalers in form of steroids, or they may take pills, corticosteroid pills, or in the emergency room, they will get intravenous injection. What happened? Cortisol will suppress immune system. As a result, inflammation will calm down. As a result, person is able to breathe easily. When cortisol become low naturally because of the low cholesterol, then immune system become more active. So there is no check. So immune system becomes active. We need to bring level of cortisol higher. Now, we talked about aldosterone, cortisol, and now we are moving into testosterone. Testosterone become lower and estrogens become lower. Is it good that maybe testosterone become low because less testosterone available to convert it into dehydrated testosterone in intestines? Yeah, it's probably could be beneficially for older men because dehydrated testosterone is responsible for BPH, benign prostatic hyperplasia. But in general, okay, what's the purpose of testosterone? Here on the left, you can see the purpose of testosterone in our body. In black, when it's normal. In red, when it's low. What happened when it's low? Sex drive or libido. When testosterone is low, it's low. Bone mass. When testosterone is low, the bone loss. Fat distribution. When the testosterone is low, especially males tend to be more obese. Muscle mass and muscular strain, less muscle. Red blood cells and sperm formation, low red blood count, and the low sperm. Now, here on the right, I'm talking about estrogens. Before I go dive deeper a little bit, I want to say that usually when females get statins, it doesn't happen before age 40, before age 50. Usually at 50, 55, onset of menopause happen. As a result, estrogens and progesterone become low because the ovaries are unfunctional. So our body depends only on estrogens that produced by adrenal gland. So what estrogen does in our body? Well, it's affects the muscular structure or muscular strain around urinary tract infection. Estrogen becomes low, urinary tract becomes saggy. What clinically we see? We see urinary prolapse. Bones keeps bones strong. As low estrogen gets, what we see, osteoporosis and osteopenia. Breasts become saggy breasts. Skin, saggy skin. Hair, thin and brittle. Mucosal membranes and skin become dry and dry mucosal membranes. Pelvic muscles become weak. As a result, what do we see? We see prolapses. We see urinary prolapse, we see vaginal prolapse, and we see a rectal prolapse, or all three. Brain. Unfortunately, estrogen responsible for healthy brain. As estrogen falls down, memory problems become more pronounced. Now, if statins are such a good drugs, they will low level of cholesterol and they will low blood pressure because of the low aldosterone. Is that such a great drug? The answer is no, that does not work exactly this way. Turns out that almost 100% of the people will have low testosterone, and statins have almost no effect on aldosterone and have some effect on the cortisol. We don't know exactly why it's happening, but I have my wild guess. If I will be at the body that does not have enough cortisol, it doesn't have enough cholesterol to produce all of those hormones. So I have to choose where I should cut. Okay, what should I produce less? I will definitely choose production of testosterone because with low libido, dry skin, brittle hair, person can live. It's kind of like no big deal. However, if you if the level of aldosterone will drop down, then the person actually will have a low blood pressure, and the result, could be very consequential. So it's, will compromise person life. The same could be said about cortisol. Now, I want to say a few words about testosterone and estrogens. When they become out of balance, low testosterone, not enough estrogens get produced, that is can create it creates acne. That's what it is. So also often people ask me, when can I expect side effect? And the answer is, we don't know exactly. It depends on many factors. What's the weight of the patient? Um, how much drugs patient is taking? What's the health of the liver? So how fast that you can metabolize the drug? What the dose you are going to take? The bigger dose, the sooner you will see the effect. So usually you start to see effect of low libido in 3 to 6 months in most of the patients. You can see that it does not happen like that overnight. And often when people complain about that in the office, it's the reaction will be, oh, what do you want? You're already kind of getting old. So you want to have a great libido. I'll forget about that. Or take some medication, some other medication, right? So guys, I hope that you understand now how statins work, how they will low level of testosterone and decrease libido. And before you start taking, maybe you should consider something else, something different. For example, healthier diet and a little bit more exercise. Okay? So with all of that said, if you have any questions, ask me there. All relevant information in the description below. Like, subscribe. Bye-bye for now.